the rising star of digital healthcare, Sarawak.
What digital healthcare actually means that everything is integrated, software and hardware and people are all integrated. With that, we can actually improve in terms of our services, policy making, as well as research.
With cutting-edge technology, convenient services and top-tier medical facilities, would you believe that Sarawak is carving its own niche in the region in health tourism? More of these exciting developments on Decimal Point. All over the world, healthcare is undergoing exciting digital transformations, and Sarawakians will not be left behind. In fact, Sarawak may be at the forefront of the groundbreaking developments in the digital healthcare ecosystem in this region, from cutting-edge biomedical research to AI-driven systems.
Through strategic partnership with academic institutions, industry leaders and government entities, the SAIC is fostering a vibrant AI ecosystem. The Centre is also spearheading projects in healthcare, such as predictive analytics for early disease detection.
Aiming to attract 5 million visitors in 2025, how would digital healthcare work hand in hand with health tourism to draw visitors into Sarawak? A very good topic actually, from the womb to tomb. Perhaps you can also share with us on any innovations on digitalization, especially with record system, medical records, and now I think for certain clinics are in cloud, particularly in Sarawak. What can you share with us?
As of currently, and actually not too long ago, medical records are all written down. Mothers come in, they're pregnant, everything's recorded down with pen and paper in a book, and then until the child is delivered. And once the child is delivered, there is another book, we call it under 12 book. They keep the child's record all the way until 12 years old, and after that, after 12 years old, there is another book. Tells us whatever problem that the child has and all that. So the problem of this kind of record system is that you lose it. You don't know where it goes, If the record is kept by the hospital, and let's say you kept by hospital A, then for some reason or other, you go to another hospital, hospital B, they would not have your records. Right? So it makes it difficult for people or the doctors like myself to treat patients when they do not know the patient's history, medical history. So it would be an innovative idea to have not just an electronic medical record. Electronic medical record, when I say electronic medical record, usually most hospital has it now, where your medical record is kept within that hospital. But it would be a great idea to have electronic health record, meaning recording everything that the patient from the womb all the way to the tomb. All right, from how was the pregnancy, how was when they were under 12 and after 12 years old, what are the diseases, regardless whichever government hospital they go to, the record, medical record is there. I see that with a large amount of data that we would have, there is a lot of potential. People are talking about big data analysis, risk prediction, and things like that. So one day we will have, I mean, it's just next door. It's just ketuk pintu. It's just coming in, precision medicine or tailored medicine for patients. If we have information, and it's just in next few years.
And earlier, Prof, you also mentioned a very interesting story that you shared on Taiwan's healthcare system, and seeming that you could envision it to be brought here probably for the next, 3-5 years.
One of our UNIMAS strategic partners, CMUH, or Medical University Hospital in Taiwan, where they've implemented using artificial intelligence to make diagnosis of a heart attack. It was of particular interest to me because myself, I am a cardiologist. This is a system where when the emergency services receive a call, a patient having chest discomfort or chest pain, and activates the ambulance. Now, ambulance will go to the patient, and the medical assistant or the nurse will put on the ECG on the patient. Now, chest pain is not equivalent to a heart attack. Not necessarily, there are many other causes. But once you have an ECG, you can actually make the diagnosis. Right? What the system does is, when the ECG is done, it goes up to the cloud. Using artificial intelligence, it will try to make a diagnosis and raise a red flag if the system identifies this is a possible heart attack. That information is relayed to the nearby hospital with a cardiologist. The cardiologist will confirm that yes, this is a heart attack. Confirm. So the system will then tell the ambulance, you go to the hospital, nearest hospital, with a heart services. Yeah, there are many hospitals. Not all hospitals actually have heart services for emergency care. So the system will tell the ambulance, you go to this hospital A, for example. And because the traffic light system is also integrated, which is a smart traffic light system, when the ambulance go across town, whenever it reaches a traffic light, it will turn green. So the system facilitates a few things. Number one, it makes a faster diagnosis. You don't have to wait until the patient reaches the hospital to confirm the diagnosis. Number two, you immediately tell the receiving hospital, hey, get ready, there's a heart attack patient coming in, get the OT ready, we will immediately go to the OT. Number three, it hastens the ambulance moving across traffic. Wouldn't you wish to have that kind of system? You know, you're going to work, every time you go to traffic light, it turns green, right? So it is actually, technically, we can actually apply it, at least in Kuching, because over the years, the government have started to implement a smart traffic light system. So what we need now is to implement a system to have a diagnosis in the ambulance itself and integrate with the smart traffic light system. We can also apply this.
I think right beside us is the UNIMAS Teaching Hospital, which is slated to be in its completion next year.
Next year.
Right. I mean, with all these practices, what can we expect to see in the coming years for the new teaching hospital?
I'm very happy that UNIMAS is going to have its own hospital, inshallah, in 2026. The teaching hospital is strategically located in Greater Kuching, not smack in the middle of town where you have a lot of traffic and all that. We are in the Greater Kuching, which is in Kota Semerahan. Now, Kota Semerahan, with better access, and the government is, upgrading the access roads and all that, we will have, I think, within 1 hour to slightly more than 1 hour, reach to Asajaya and Simunjan. So that catchment area, so it's about 70,000-80,000 people, we will be able to cover those group of people. The niche area for the UNIMAS Teaching Hospital is reconstructive and rehabilitative care. The Sarawak state is approaching an aging state. by 2028, 16% of the population will be aged more than 65. That is 2 years earlier than Malaysia, which is expected to be 2030. Older people tend to have more issues, more problems. Some of the problems include osteoarthritis, mobility problems, as well as stroke. Now, in Peninsular Malaysia, those who subscribe to SOCSO and having a stroke, they can be referred to the SOCSO Rehabilitation Center, which is in Malacca. And they have robotic-assisted rehabilitation, all that. UNIMAS has a strategic collaboration with SOCSO. Inshallah, what we want to bring into Sarawak is robotic rehabilitative care using robots from Japan and maybe from Taiwan. These will improve healthcare in terms of rehabilitation for patients after stroke or even patients who are after osteoarthritis, knee surgery to start to walk again with robot assist.
So you mean emulating from Japan, and you had shared any experiences that you had from Japan's healthcare systems that which we may see in the teaching hospital as well? Maybe you could share.
A few years ago, I was visiting GC Medical Hospital. The hospital had a lot of collaborators from industries, from like Kawasaki industries. You see, the thing about these car industries, they are very familiar with robots.
Yes.
Because they use robots for construction of the cars and motorcycles and whatever parts. So Kawasaki, under their own CSR project, they contributed to research with GC Medical Hospital using their know-how of robots and applying those robots for treatment of patients. You know, so that's where they come up with robotic, rehabilitative and such not. So it's quite interesting. The other thing about Japan is very large. And curiously, if you look at the map of Japan, it looks a little bit like Sarawak.
You are right about that. You are right about that.
They also have the problem of patients in the outskirts, in the rural part of Japan.
Definitely.
When you talk about Japan, you think about the big cities, Tokyo, Osaka, Kyoto, but there are also small cities where super consultants, specialists, doctors may not be there. So when patient requires treatment, specialized treatment, they have to travel all the way back to the big cities, and sometimes patients don't want to. So one of the solutions that they made was putting robots in these smaller hospitals. Instead of having the doctor, the specialist doctor, there are doctors in that hospital, but not the super consultants. Instead of them traveling to that hospital, they can do surgery in the big city, and then that through 5G network will make the robot do the surgery in a smaller hospitals. So you are in the big city controlling the robot somewhere else doing surgery. So that's how it was in Japan. How they make sure that even the smaller districts out in the outskirts receive similar care of healthcare as in the big cities. When they come in for health checkup, they don't come in alone. They come with their families. The revenue in 2020 is exceeding 90 million for that year, just from health tourism.
We're here at one of the top universities in Sarawak, leading the charge in digital healthcare practices, collaborating closely with renowned medical institutions like Sarawak General Hospital. Now, another interesting development that I know is launched in 2025 as well in the UNIMAS Training Centre. Maybe you could also tease a little bit, what is the cutting-edge technology or advancements that Sarawakians worldwide are yet to see?
Alhamdulillah, I would say Unimas have good state-of-the-art facilities in terms of training, and in fact, our clinical simulation centers is among the best around the region and among the universities in Malaysia. We are training our students not only the usual clerking the patients and seeing patients in the hospital. We are training them to also incorporate how do you use artificial intelligence to help you learn, to help you make a diagnosis for patients. And we're using simulators. Like right now, we are in one of the simulator. Simulation. This is an ICU simulation for training of the students. We also have simulator suites for emergency departments, and we have a simulator for using ultrasound, teaching the students how to use an ultrasound on a dummy. What we want is to have a safe environment for the student to learn at their own pace, and also safe for the patient as well.
Unimas' success with SGH in implementing the Sarawak transformation in the medical sector with the management monitoring dashboard as well as the patient tracking system. What can you say about that?
You mentioned about the dashboard and the patient tracking system. This is one of the initiatives of Unimas researchers trying to solve real-world problems. Now, everyone knows, I think would know, that Sarawak General Hospital is chronically having a problem with bed shortages. So last time when I was working as a medical officer there, as a doctor, you should be treating patients. But when a patient needs to be admitted, now it comes to another problem for us doctors, is trying to see where and which ward they should go to. Right? And this takes away our time from actually managing the patient, but instead we're doing logistics. So this is where digitalization can help. So Unimas, in collaboration with Sarawak General Hospital, has developed a dashboard system to have a real-time data on which ward where beds are available and how many patients there are at one time. This was launched late last year. And with that, we are able to know, let's say, for example, a patient needs to be admitted in this discipline A, for example, this ward A, but ward A is full. But that doesn't mean that the whole hospital is full. There might be a bed somewhere else, but with the system, we'll be able to identify where to put the patients. This is to optimize the bed occupancy rate of the whole hospital. But another avenue that we should be looking into in reducing cancer rate in the population is preventing cancer from happening in the first place. That's where researchers from Unimas, like Prof. Edmund Sim, who is a cancer biologist and bioinformatics researcher. Prof. Edmund and his team has used data from previous patients, looking at the genetic types and their phenotypes. They developed risk stratification tool using AI, and they call it Carissa. What is Carissa? Carissa is an online system for anyone to log in and put in and key in a few information into the system, and the system will help the patient or the person to tell him that you are at risk of this, so that the person can take appropriate precautions and what to do. Right. It is available online. Like what we usually say, prevention is better than cure. Right. Sarawak government has always been very supportive of digital transformation, and especially also in healthcare. SDC and SMA has always been, supportive. Some of the things that we've been doing, for example, during COVID-19, we had a lot of data regarding outbreaks and all that. Professor Jane Labadin from UNIMAS have used those data to actually do a model of where the next outbreak will happen and to control the outbreak of COVID-19 at that point in time. Prof. Patrick Ten from Swinburne is also doing a lot of research on that, and together with Sarawak Heart Centre, a centre which I am affiliated with. What he's working now is one of the AI-generated avatars and using LLM, a large language model, to see whether patients can talk to the digital avatars, and the avatars using AI try to list down appropriate differential diagnosis and diagnoses the patient would have. This probably will hasten the clocking of patients and see. But it's still something in the pipeline, but we're looking forward to see more results from there.
Yes, this is something, and hopefully, over the years, it's always developing. So Sarawak is on its pipeline and way actually as a digital healthcare hub, hopefully. And now we're centering on the topic of health tourism, Prof. We can see that over the years, even Singapore has been competing with Sarawak as a medical tourism hub, with most coming in from Indonesia. In 2023, I think it's reported that at least 28,000 visitors are coming in for its medical tourism or health tourism.
Yeah, I think over the past, I would say past 10 years, Sarawak is slowly but surely developing into a hub for health tourism. And in fact, right now, the major income for private hospitals in Kuching, at least, comes from health tourism. In 2023, up to I think about more than 50 million of revenue comes from healthcare for international. But not only that, if you take into account that what else they bring in, because when they come in for health checkup, they don't come in alone. They come with their families, and then they decided to stay and then do a little bit of something touristy, goes here and there. The revenue in 2023 is exceeding 90 million for that year, just from health tourism. So we are actually have a lot of potential for that. And you mentioned Singapore. Singapore has developed the health tourism industry for a long time. I remember in the 80s they were already there. But we're looking at different kind of clients. And I said majority of our clients come from Indonesia with a population of more than 270 million. Right? There are all levels of socio-economic status. For Sarawak healthcare, we are, if I may say, we are good, among the best in the world, and we are also cheap and affordable. And mind you, we're not cheap, because when you say cheap, the connotation is, the service may not be so good. But I would say we are good and happens to be cheap. Right. Just a little bit of sharing. The Sarawak Heart Centre was listed among the top 100 cardiology hospitals by the Newsweek magazine a few years ago. Yeah. So that is the level of healthcare and services that we provide here in Sarawak.
You see, and finally, what you have to say, apart from its facility, tourism-wise, transportation, any other accommodations that Sarawak needs to prepare to attract these tourists for years to come?
I think the government is going the right direction with a recent acquisition of the MAS wing. Now we have our own airline, which is Air Borneo. Now, these will increase accessibility of Sarawak to the rest of the world. It will increase accessibility of Sarawak cities itself, but also accessibility of Sarawak to the rest of the world. So now being able to come easier to Sarawak without having to go via KL, via Kuala Lumpur, and fly directly to Kuching, definitely will increase not just tourism, but also health tourism as well.
Indeed, The digital transformation healthcare in Sarawak truly brings new life to the saying, health is wealth. Not only does it improve healthcare services for our aging population and those in rural areas, but it also attracts patients from beyond Sarawak's borders. Here's to a healthier, more vibrant society on Decimal Point.